Hi, my name is Joanne Yang, and I'm a Master's of Public Health student at UC Berkeley, California. This summer, I had the opportunity to work with the UCSF Nagata Lab and Dr. Jason Nagata, examining adolescent bedtime screen use and their sleep outcomes. Dr. Nagata and his lab focuses on studying various health behaviors such as digital technology use, sexual risk behaviors, substance use, eating disorders, and physical activity, and how they can influence various health outcomes in adolescent and young adult populations. Our study was done as part of the ABCD study, which is an ongoing study tracking the biological and behavioral development of 11,880 adolescents from ages 9 through 10 to young adulthood. There were several reasons why we decided to pursue our research question. Screens have become more common over the years, especially as technology becomes more integrated into our daily lives. This image on the right is a visualization of screen time averages from our ABCD study cohort, and you can see that screen time has exponentially increased within adolescents since 2016. We knew that screen time use had previously been linked to poor sleep quality from research, but there was little information known about how screen use before bed might influence this relationship. We hypothesized that increased bedtime screen usage would be associated with greater sleep disturbances. So for our methodology, we had data from the first 2 years of the study, which contained information from annual surveys about the participants' bedtime-specific screen use behaviors and their sleep habits. I was tasked with cleaning the data for analysis, creating summary variables using multiple survey questions that could numerically describe whether the adolescents had experienced sleep disturbance and how much screen time they were partaking in across different devices. Screen use included, but wasn't limited to, TV, video games, phone, social media, texting, studying using laptops, reading on an electronic device, and emails. I then used these measures to run logistic and Poisson regression analyses. All of my work involving the data was done using Stata. There were several findings in our study, but a few of the more significant ones were that out of the 10,280 adolescents that we analyzed, who average aged 12 years, 15.5% had trouble falling or staying asleep in the past 2 weeks, 16.9% were woken up by their phone while sleeping, and 63.2% had a TV or electronic device in their room. We discovered that adolescents that browsed the internet or played video games before bed had a 23% higher risk of trouble falling or staying asleep, as well as a higher risk for overall sleep disturbance compared to those who did not. There were also a 30% higher risk of having trouble falling or staying asleep for those who spent time in chat rooms before bed or had a TV or electronic device in their room. We also learned that adolescents that use electronic devices after being woken up in the middle of the night had a 38% higher risk of having trouble going back to sleep or staying asleep, and a 13% higher risk of overall sleep disturbance compared to those that didn't. So for our conclusion, we were able to establish that there is an association between various screen use behaviors near bedtime and sleep disturbance and quality. Many bedtime screen use behaviors are related to higher risk for poor sleep quality. Our study was the first study that we know of to evaluate specific bedtime screen use behaviors versus overall screen use in relation to sleep outcomes. Some of our limitations were that we depended on self-reported measures from adolescent annual surveys, so the robustness of our study is a bit limited. However, based on these results, future researchers can try to use objective screen and sleep measures for less biased analyses of screen usage behaviors, and our findings are beneficial because they inform healthcare providers in educating parents and adolescents regarding screen use behaviors, and can also be used as evidence in future recommendations or guidelines for screen use around bedtime. I would also like to thank Dr. Nagata for his guidance and direction in this project, as well as my colleagues at the Nagata Lab for their feedback and input in completing this project. I also thank the Western Region Public Health Training Center and UC Berkeley's RISE office for their generous funding of this project. Thank you.